We'll go ahead and get started. I think a few other people might be trickling in over the course of the time, but we'll just welcome them when they arrive. I want us to all introduce ourselves. My name is Dr. Zach Ward. I'm a licensed psychologist at UC Davis, and I've been one of those coordinating the Student Mental Health Initiative over the course of the past at least 2.5 years.
I'm Dr. Danen Adelson. I'm the current coordinator of the grants, working closely alongside with Zach.
I'm Napolitan, and I am essentially the head of our marketing department, and I also am a programmer, and I do some IT project management as well for our unit.
So with our Each Aggie Matters campaign, we knew really right off the bat what some of our primary goals were. So I want to mention those. I want to talk really briefly about the goals of this presentation. The goals for the overall campaign we knew were to increase an open and affirming dialogue about mental health on our campus, to actively work to address the stigma and discrimination connected to seeking mental health services, to allow for our students to feel more comfortable and willing to utilize resources on campus when in need, and lastly, just to foster a campus community of acceptance and support around mental health. For this presentation, we're going to be talking about the campaign specifically and then move into some of the effective marketing strategies that we've implemented over the course of the past year as we've disseminated this campaign across campus. So to start, we knew what our general goals were, but we then wanted to move on to finding out about other programs similar to what we had in mind, if there were kind of models already out there that existed. And through the grant and collaboration with different entities underneath the umbrella of the grant, we came in contact with the Each Aggie Matters campaign. We loved this campaign, thought it was wonderful, and also thought that we could really tailor it to our specific campus community and make some additions to it that really served our specific community a little bit better. So having a general vision and a model, the next thing that we did is just sat down with marketing. I sat down with Adam and we did several different brainstorming sessions to figure out how can we kind of roll this up into an effective campaign that we can disseminate across campus effectively.
And so when we first sat together, one of the first things we asked ourselves is, what do we really want to do with the website, and how do we want to use it to achieve our goals, and how are students going to actually use the site? How are they actually going to be engaged with the site? So we wanted to make sure that we didn't end up with one of the biggest fears in marketing, which we call singing in the shower. You don't want to be singing in the shower when you're marketing. You generate all this great communications, and there's really no one there listening. So we want to make sure we stay away from that. And by doing a lot of different strategies, we wanted to make sure that we would essentially embrace the fact that everyone's kind of got their different way of connecting with messaging, whether it's advertisements or communications. You know, they might be more of an analytical person, they might connect more with statistics, they might connect more with some messages from their peers or from mentors. So we tried to think of all these different things that could impact how they would engage with the campaign. So we wanted something not only effective, but something that would resonate with the students. So we came up with a 4-pillared marketing approach, which the first pillar is community, which is shaping and building a community, access, relate, and educate. And these are the 4 pillars of the program, spelling out care. And so we'll be talking a little bit more about each of these.
Yes, I'm going to go into a little bit more detail about these 4 pillars that we utilize for our unique campaign. So community is a section of the campaign where community members can submit a pledge to support their own mental health or the mental health of their respective communities. As Adam kind of mentioned, we do see community as having 2 parts. One being shaping the community through inviting these pledges, and another being building the community through various resources that we have on our campus. So here we have an example of one of our student pledges from a member of our Each Aggie Matters campaigns. As you can see, Alexandra committed to pledge to listen without judgment to each and every one I have the privilege of being invited to hear. And pledges are not limited just to our student body. We invite all faculty, staff, lecturers to make a pledge and join our Each Aggie Matters campaign. And one of our major goals is to increase the visibility of those in the UC Davis community who are affirming of mental health, willing to talk about mental health issues, and willing to utilize mental health resources. Here you can see just a snapshot of the diverse collection of pledges and commitments that we received. And after only 2 events that we hosted within a 3-month period, we collected 605 pledges, which we see as a huge success. Thanks to the grant that we've been working with, we had the budget that permitted us to utilize some marketing incentives. So as a token of gratitude to those that joined the Each Aggie Matters campaign and pledged, they received either a t-shirt or a water bottle that we have lovely on display right there.
And I just wanted to echo on that. One of the things we tried to do as a strategy when we started this is we wanted to actually tap some of our connections we already had made on campus with students and peers and whatnot, so that we had kind of a launch pad, so that we had already a number of students that had already committed pledges and kind of set the pace for the rest of the campaign. So having kind of some of those right at the beginning, it helped us to kind of to start at least not at zero. We already had, you know, a number of pledges when we started our campaign. And so actually, if you were to look at what represents an Aggie in terms of logo, this is a logo of our mascot, Gun Rock. And so this essentially is an image that embodies our student body in terms of what an Aggie is. And so we kind of took this literally, and we took all of our pledge photos that we received as well as event photos associated with this project, and we actually created this mosaic. So this is, it's not really fuzzy, it's actually because it's created by all the individual pledge photos. So, so we actually used that very direct symbology, and this is going to be on our bus ads as well, so the students will be able to walk right up to it and see all the faces associated with it. And with that being said, in order to do something like this, we had to make sure that we did our due diligence in terms of legal.
Yeah, so we just wanted to make sure that everyone that participated in the campaign were fully informed and consenting to the process of their pledges being a part of this. So we consulted with campus legal, with the UC Davis Health System, as well as student affairs, and developed 2 different documents for all of our participants to sign. One was giving us permission to use the written work through a pledge or through telling a story. The other was allowing us permission to utilize their photos. And so when someone participates in the campaign, they can do as much or as little as they feel comfortable. They can provide an anonymous pledge that will in no way be connected to them, and in that context, they don't need to complete any paperwork. They can do a pledge or tell their story and just have their first name, last initial associated with it. Or if willing, we'll take their photo and attach their photo next to the written work. So 2 different forms that we've also provided in our toolkit for all of you to be able to reference down the road if you ever wanted to copy this and use it on your campuses.
So an additional goal that we have in the community category is to connect our UC Davis community with other resources on campus that advocate for mental health and support our students. And this just highlights some of the resources that we have on campus. Some of them might look familiar, just might have different names on your campus. And so these are additional resources behind kind of your stereotypical counseling services that we do make sure that we're working closely with and we have a close working relationship. Which is kind of a nice transition into this topic of access, which is the second pillar of our 4-pillar plan. So this section of the campaign specifically targets alternatives beyond counseling services. So here we have one of the great things about UC Davis is we have something called the Mind Spa, which utilizes massage chairs, biofeedback, relaxation, audio clips, again, an alternative for students. Additionally, we have massage therapy at our Student Health Center. We also have our Community Advising Network, which is we call our CAN counselors. And what this is, it's a team of community counselors that are actually located in various campus resource buildings, disseminated across campus, that specifically targets working with underprivileged populations that students can easily access and they can assist them throughout their time at UC Davis. We also have something called college counselors, in which we have actually implanted mental health providers into certain colleges. So the College of Engineering, College of Letters and Science, all have individual mental health providers located in their college. And then group services is an additional resource we have. So invites students, faculty, and staff to connect in this lived experience type of way. So people can submit their personal stories that explore ways that mental health struggles have impacted them personally or maybe on an outer periphery. So these personal stories instill a sense of hope and directly combat that concern that so many times we hear our students kind of say when they walk in their door, I thought that I was the only one that had this thought or this feeling. So here we have something that Carly shared with us. It's hard to see your mom at a young age unable to work and lay on the couch all day, depressed and in pain. Carly is the former ASU/CD president at UC Davis, so she's somebody that's very familiar, is well known on campus. So her participation in this campaign, we're very lucky to have. And so by providing models of others who have struggles and that have utilized counseling and other resources to help, our hope is to really reduce that sense of isolation or shame that those in our community might feel when trying to manage or cope with their own feelings. And educates, provides really educational information, tools, resources, and self-care tips to our community, including infographics, as you can see. Very user-friendly, very straightforward information. And we have a couple of these on our website that address very common mental health issues: stress, depression, anxiety, time management, sleep hygiene. And then additionally, we include videos that include very common TED Talks that address various mental health topics, and videos specific to UC Davis campus issues with mental health. And we also have some public service announcements that we've made specific to UC Davis. I'm not sure if anybody here was in the previous program of the Each Matters, but through Each Matters, we're actually able to connect with Amanda Lip, and we were actually lucky enough to have her as our keynote speaker at our launch events for Each Aggie Matters. So.
Real quickly, another thing that the website does is it connects students with our Just In Case mobile-friendly website. Just In Case is one of the vendors out in front that a lot of the different UCs have contracted with to provide resources on recognizing signs of distress and what are the resources on campus that I can utilize in a moment when I'm feeling overwhelmed. And so one of the tabs on the website is connecting them to this, and it's a great way to cross-promote and cross-market some of the different initiatives that we have in our counseling center.
And with Just In Case, it's really targeted specifically for mobile devices and even more specifically for smartphones. And so when we were developing our site, we wanted to make sure that we could target all device platforms outside of even just mobile devices. So we use something called responsive web design. Although you may have not heard it before, you've probably interacted with it. And what that just means in a nutshell is that it essentially allows us to target different device platforms based on the width of the device or the width of the window. And so that allows us to make one website for all of the different devices. How many of you have ever gone to a site and then you get sent over to a mobile version of the site, right? And a lot of people, when they're given the choice, they switch to the full version because they're missing something they need, right? Because one of the core features is missing. Sometimes you can get rid of advertisements and that's great, but a lot of the times people are switching to the full version of the site. And also another thing I remember about around Christmas time, when my partner is sending me her Christmas list, and one of them was a really nice pair of boots, and she sent it from a website that sent it to my desktop, which is a big 27-inch monitor, and I'm seeing the mobile version of the website, which was really frustrating as a web designer myself. So there's a lot of different ways that you have to handle that if you have two separate websites. With responsive web design, you can use one site to target all of these different device platforms, and so it's a lot easier to maintain. Your IT department will like you for this, and so it's really nice way of delivering it. So we can actually target each and every one of these platforms with different priority of messaging, so we can put certain things on the top for the mobile phone version and change where it's located on the desktop version. And so just to give you a quick glimpse of this, so you can see the mobile version is very just linear, very limited navigation. Tablet's similar, just a little bit wider. Laptop, you can start to see that we can expand the navigation and go two-column on certain sections of the site. And then desktop, we can actually use the full real estate of the site. So we essentially employed that for our site, and we've actually been kind of at the forefront. About 4 years ago, we launched the first responsive web design in all of higher education with our Safe Party website. So we've been kind of using this for a while now. But this is just a simple example of its use. And so another part of it, actually, before I go into the timeline, is that we developed another site just to collect the pledges and stories that we were talking about. And so we had to develop that separately. And so we wanted to use some out-of-the-box tools. And so many of you have probably heard of WordPress before. So we use something similar to WordPress, but it's called Drupal. It allows you to customize more. It's much more scalable, so we can actually expand as needed. It was actually used for whitehouse.gov. In the most recent development of the White House website. So it really met our needs, and we use it for a lot of our internal sites. And we also used another theme that's developed by Twitter called Bootstrap. So if you are looking at doing something like this and you want to have whoever you're working with talk with me, I'd be happy to talk with them about what I used. So in terms of timeline, we wanted to try to make it as quickly as we could. Our image creation probably took about 2 hours of design work. And then total development time between developing 2 websites was approximately about 80 hours of development time. So it kind of gives you a good gauge of, can you commit, or can your team commit to something like this, or can you contract it out? So if you have any questions, I'd be happy to talk that through with you.
So we know that this website is sort of the flagship for Each Aggie Matters, but in order for it to be really effective, we have to utilize several different approaches to actually get out to where many of our students are who may not be accessing this website, or who may not be on social media, for example. So we particularly want to reach those students that when they're feeling overwhelmed, they might be isolating. And we all know that oftentimes when students are in significant amount of distress, or when they're having thoughts of harming themselves or taking their own lives, oftentimes those are the same students that aren't utilizing our resources and that aren't walking through our doors. And so we wanted to make sure that we got out to them. And we did that in several different ways. The first is that we would actually go out to the classrooms. We identified all of the classes with several hundred students in them, asked the professors if we can go in and speak in just the first 5 minutes or so of it to orient our students to the campaign and encourage them to go onto the website and make a pledge if they felt comfortable. We also engaged in several different activities. We had a launch event. We had 4 different tabling events where a student could be walking out of the class and walking across the quad and see our canopy with all of our signage with these great giveaways, and possibly would just want to know what's going on over there and walk over and get a chance to learn about the campaign through that. We also collaborated with all the different student centers, and so they would have signage and our information in each of their centers, and so if a student perhaps was comfortable enough to go in there but not yet our counseling center or didn't know our website yet, they'd come across it through that means. And then lastly, we participated in some of the larger campus events like the 5K Stride for Aggie Pride event.
And just to give some context on the Stride for Aggie Pride, so it was a pretty large-scale event. Approximately a little over 3,000 people were in attendance at this event. And actually, what was most interesting about it was that students were lining up after they ran the 5K, and it was pretty warm. They were lining up and waiting over an hour to submit a pledge. So that meant a lot to us, and they were there for longer than an hour just to get a water bottle. It was more than just the water bottle. A lot of them really wanted to participate with this campaign. So that was really exciting for us to see. It was more than just the giveaway. They were waiting more than an hour in line just to get their pledge in. So that was great for us. And another event that we have is Therapy Fluffies. So Therapy Fluffies is run every quarter around midterms. You've probably heard about this before, but it really is great for our campus. It goes bonkers on social media. Right when we start to promote it, everyone's sharing it on campus. So it really does have a large reach, and we're working together to have Each Aggie Matters at every future Therapy Fluffies event as well.
We also connected our campaign with the depression screening that we did back in October of last year. This was actually the first event where we sort of put the name out to the campus community. And over the course of that 2 or 3 hour time span, we collected 250 different assessments from our students, and were able to inform them about this campaign as well. I want to just speak briefly. One of the only downsides to a depression screening is that oftentimes immediately after that, our counseling center sees a pretty significant influx of students coming in, because it's not just an outreach effort, it's also an assessment and oftentimes an intervention effort as well. One of the great things about Each Aggie Matters is that it can do a lot of that same type of prevention. It also, we can collect really good numbers to be able to demonstrate the effectiveness of this campaign by talking with essentially our bosses about the number of pledges and stories that we've been able to collect. But what it does is it makes this sort of more of a shared effort where it's not just our counseling center that might see an increasing utilization of services. In fact, our counseling center may not even immediately see an increasing utilization of services, but what's going to happen instead is our students are going to start talking to one another, and they're going to start utilizing perhaps some of the other campus resources like our Women's Resource Center or our Cross-Cultural Center, and getting the help they need through them. Because as clinicians in the heart of a quarter, we all know how busy it gets and how hectic it can be, so to share that load with the rest of our community can be really effective.
So I wanted to actually share some numbers here. So this is actually counseling service visits in October of 2012, the exact month after the October 9th date. So we wanted to have comparable for year over year. Now I didn't want to add some extra context to this in that we did do some restructuring around appointments to have more appointments available. However, you'll notice that the numbers are a little more than coincidental. Whoops, wrong way. So the difference actually is very close to the number of screenings that we administered. So in that year over year, it was approximately 222 extra visits that we had compared to the year before. So the nice thing about it was the timing of the event. In fall for us, it's less impacted than in winter or spring for our center. So doing this in fall was probably the best time for us to administer something like this.
So another thing we did is we really worked to engage our students with this campaign. We have an Active Minds chapter and a NAMI chapter on our campus. And so we got them involved from the outset and had them take part in the launch event and a lot of our different tabling events. And as a function of that, both of those groups have really taken on Each Aggie Matters campaign as a part of their identity. And it's something I think that's going to help the campaign move forward successfully in the years to come. So I wanted to just talk very briefly about the pledges and the tell your story aspect of the campaign, because I think this is really the heart of the campaign. And we know that this is effective on multiple different levels. I think intuitively we all know that when we open up and when we share and we create a sense of community around us, that's a really good, healthy, productive thing. I also know as a clinician about the importance of communication and self-disclosure and authenticity and creating a sense of community around us where we don't feel judged and we don't feel a sense of stigma, but instead feel accepted, particularly when we're struggling. But there's also some really good empirically supported data that speaks to the effectiveness of this campaign. One is that of making commitments and setting goals. We know from research that when someone writes down a goal that they're significantly more likely to follow through on it down the road. And that's essentially what we're asking of people when we ask them to make a pledge. So when they say that they're going to be an advocate for their friend or for a family member or for themselves, and they put that down on paper or put that down on a website, there's just such a better chance that they're going to follow through later on down the road. The other thing is that this is a really good example of pro-social modeling. And when our students see other students having sort of the courage and the authenticity to be able to speak up and say, this impacts me, and I've been able to utilize the resources that I needed and the services that I needed, and it's made a really great difference. That teaches the students around them to do the same when in need. And so I wanted to just briefly speak to sort of the proof in the pudding as to why this campaign would be effective.
And another part of it that I think was extremely important was that Zach and his group would actually look through each of these. Do you want to talk about?
Yeah. So particularly with the stories, we got significantly fewer stories than pledges, which I think is understandable, just because of the amount of time that it would take to do one versus the other. But those that submitted stories, I would oftentimes mentor them on that writing process, and we'd go through a couple of different drafts until it reached something that they were really comfortable with. Oftentimes because a first draft might, for example, the first draft would potentially say something really strong and problematic about family members, and then letting those students know that there's a good chance that your family's going to see this, and So you may want to just acknowledge that and think about that and how that might be for you. They didn't craft it in a way that still felt really authentic to them, but also didn't feel threatening in terms of who might also view that message. So that was really neat because it became this sort of quasi-therapeutic experience for them to write their story and go through several iterations. Secondarily to that, I think it just produced work that they were more proud of and that they were really happy and willing to share with the rest of the campus community.
And that being said, this was actually one of those things that actually generated a good amount of social media coverage, because what happens is that they would mention to their friends or their family that they were featured on a website. You know, everyone kind of likes it when they're featured on a website, right? So they're kind of sharing it with their friends, which kind of gets that levels of separation and allows us to reach maybe their peers or their friends that might not be engaging with this campaign. So it was really effective from a marketing strategy as well, because they wanted to share the stories about themselves. So they kind of are our marketers out there marketing themselves. So that's really helpful. So a lot of those were direct marketing strategies that were really important to this campaign, and I think were really important for the success. But there are other advertisement channels that we used strategically. So our Unitrans buses, for example, they have a large ridership. So about 10,000 students are riding this every day, and the average number of trips is about 3, because some students are riding it more than once round trip a day. So you have them riding it about 3 times a day on average. And so we had our advertisements inside the bus. Next year we will be having it exterior as well as interior, so we'll have even more coverage from this advertisement channel. We also utilized LCD displays on campus. So in addition to our 2 primary locations where we have LCDs, we also work together with other student affairs marketing groups and other marketing groups on campus that have LCDs in their buildings. So we went out to the libraries, to the eateries. Essentially, we worked with student housing to have LCDs there. So we really did try to get as wide reach as we can in the highest foot traffic areas.
Also, with the help of Campus Communications, we developed 2 different press releases, one for the Each Aggie Matters campaign, and another for the Just In Case mobile-friendly website, and disseminated that to various different news outlets in the Northern California region. And as a function of that, we were able to have a story in the Sacramento Bee, in the Modesto paper, in the Woodland paper, and several online journals also picked up the campaign.
So these are all social media channels you're probably familiar with. The ones that are still highlighted are the main ones that we focused on in our campaigning. Now, we also have really good relationships, before I talk about how we use these channels, we also have really great relationships with the main campus social media coordinator, as well as student affairs social media coordinator. And we made sure we had really strong relationships with them going into these campaigns so that they were also covering as we were going through this. So that was a really extremely strong ally going through this. So in terms of Facebook, we really focused more on event promotion using Facebook. We also have other general messaging, but that was really the core function of our Facebook, in addition to kind of healthy tips and whatnot. With Twitter, it's kind of more in the moment and a little less formal language. And we also use that to have kind of daily be well kind of tips and helping them with that. And we've actually had great coverage. Actually, Huffington Post has retweeted a few of our stuff, so we're excited about that. And then Instagram, we're starting to expand that this next year. We just started it, but we'll be working on getting wellness-related posts in Instagram. Our blog is actually the second most read blog on campus. We actually get between 3,000 to 4,000 readers a month on our blog, and we just started about 6 months ago, 7 now. So we really have some of these great assets that we were able to use and kind of champion some of this language that we're putting out there. And so we have a lot more stuff coming in our blog this next year, but we'll be using that extensively. And then YouTube, we use to house essentially all of our videos and PSAs and any of the videos that we delivered on our website. So I wanted to give some context to numbers, so I don't like just throwing numbers at you. I wanted to show you One World, One UC Davis is a very large campaign. I mean, this is $1 million campaign. And during the same amount of time as our launch event, essentially a couple month period, they had 6,984 page views. And drum roll, we had 8,532 with a much smaller campaign. And I think the reason that this is because we had so much more of that direct channel marketing approach where we were on the ground, connecting with students, getting them involved with the pledges. That utility of having the pledges and the stories coming through our site really did bring more people to the site to utilize. So that is, I think, a really large scale of it. But I also want to mention, in addition to just this page view, I actually noticed a statistic that stood out to me. So our main SHCS site is very mature and is one of the more successful websites on campus. We get about 200 to 300,000 visits a month to that website, which is way more than our student body because we get international traffic as well. But that being said, since it's so successful, it was interesting that there were 122 unique visitors that came to SHCS website that had never been there before. So if Each Aggie Matters had not been around, that campaign, those 122 people, and these were specifically from Davis, California, if those visitors never went to Each Aggie Matters, they may have never came to Student Health and Counseling Services. So that really stood out to me. Even though it's not thousands, it's still 122 people that may have never come to our website if it hadn't been for Each Aggie Matters.
And so we feel like we've gotten a lot of momentum with this campaign, and part of that has been our students and their involvement. Another part of it is this grant and how it provided us the time and the energy and the resources to be able to put in to this campaign. And so now the big question for us is how do we sustain this and how do we make it something long-term that's a part of our campus community, a part of our identity.
And so our plan actually to keep this going forward in terms of a web and online asset strategy is we are planning on expanding all of our resources on the site. We have plans to expand each and every one of those pillars we're talking about: community, access, relate, educate. And we already have a plan on redesigning the homepage, essentially because that was developed so quickly and rapidly for the grant. We do have plans on what our next stages will be. So we are planning on getting a lot more community resources embedded and various other pieces. In addition to that, we are also planning on expanding the scope. We're also going to be working closely with our health education team, and they will be incorporating, essentially co-branding their campaigns with Each Aggie Matters. So when they're doing physical activity, sleep, and nap health, they will be co-branding that with Each Aggie Matters. And so they're looking at more than just emotional wellness. They're looking at other areas that indirectly impact their emotional wellness. So we're looking at a much more comprehensive wellness approach with this and taking Each Aggie Matters through all 7 dimensions.
Where those, I think, are wonderful strategies. I think ultimately what's going to make this successful is our students and their involvement and their engagement in this campaign. Our peer advocates are moving forward, going to have a really big presence with our Each Aggie Matters campaign. They're going to be doing a lot of the marketing, a lot of the tabling events. And as effective as we can be with this campaign, I think we're both really limited in our dissemination of this information to our students simply because we're not students. And me being a psychologist, there's a lot of people that don't want to see me just because of my title. And so to put a student as the face of this campaign is what makes it most effective. This is also going to happen with our non-Main Active Minds chapters on campus. But one of the things that was just such an affirmation for me in terms of the effectiveness of this campaign is that every single time we did a tabling event and at our launch events, students would come up to me, would come up to us and say, how do we get involved in this? Like, I love what you all are doing. How can I get involved? What can I do? And so we actually started making a list of all the students that wanted to participate and giving their email addresses and their names and phone numbers so that later on down the road we can get in contact with them. As great as this campaign was, just to be honest, the first time that we did the tabling event, felt really anxious and sort of vulnerable, thinking, I'm asking a ton of these students, and it didn't really hit me. It didn't hit me like what I'm asking of them until I was standing there at the tabling event, and they're all walking past me, and I'm thinking, are they going to be willing to come in here and into this tabling, into this canopy, and self-disclose and be vulnerable enough to talk about how this impacts them in their own lives? And in our first tabling event, in 2 hours, we got 117 pledges. And to me, that's gigantically successful. And to have our students come back over and over and again saying, I want to be a part of this without us even putting that invitation out first to them, just I think speaks wonderfully to the momentum that this campaign can have on our campus.
And I just wanted to echo, I was actually at home when the Stride for Aggie Pride was happening, and I get email alerts when every pledge came in. So my phone was just bouncing off the table because there had been hundreds of pledges that were coming in. And my partner told me, can you silence your phone? Because it was just going off consistently. So it was really exciting when we're seeing that much engagement happening at these events. So it was a very pleasant surprise. So we're really excited about that.
So we put together a toolkit to make sure that everyone in the audience had access to a lot of the resources that we used in developing this campaign. So we're going to hand out a flyer that has the web address for this. It's a really big file, and so it wouldn't, we'd have to hand out like USB storage devices to you all to get all the content. But feel welcome to go to the website to utilize any and everything that you see. You know, we got a lot of mentorship and advice and feedback from Each Aggie Matters, and so as happy and as proud of this campaign as we are, we don't see it as ours, we just see ourselves as part of a larger movement, and so we happily will share with anyone else that wants to take part in it as well.
And I'd like to echo on in terms of the toolkit. So we do have essentially as much as we could pack in there. It is very extensive in size, so you're going to have to wait a little while it downloads. But we do have the pledge forms, consent forms, all of that included in it, so you don't have to do the groundwork, or you still probably will run it through your local legal as well. But at least you have a good starting point, and I know I myself would be more than happy to talk with if you have a web designer or somebody who deals with web in your unit, or marketing strategy, and I'm sure the same goes for Zach and Danen.
So with that said, we wanted to open it up to any questions or comments in the audience. In the back.
In your campaign, between like the pledges and the 230 assessments, did you find out anything interesting, like what the percentage of females and males or anything like that, or did you draw any kind of statistical stuff that made you go, we need to have better ways of maybe finding different populations in the student community?
That's a great question. We, with the information that we got back from our students, we didn't collect any demographics, and so that would be something that we could potentially explore down the road. But with that mosaic that we developed, you can visually see a lot of the diversity in terms of the students that took part in the campaign.
And I think that's also partly why we tried to get as many direct strategies as possible to get out there and connect with students that might even have a friend that is going through something that maybe that they'll connect to our resources or the campaign. So we try to focus, I would say, a good 80% of our efforts on direct channel marketing.
Yes.
I was curious, I was impressed by the numbers of depression screenings you did, because you do that annually, but you don't get such big numbers. I'm curious, did you do that screening before Each Aggie Matters, and do you think Each Aggie Matters campaign added to that, or are there any tricks?
So we did the depression screening prior to the formal launch of the campaign. So students would just see this banner on the screen itself and connect it, but didn't even formally know what it was at that point. The reason why we were so successful is because of these right here, because we gave out water bottles to everyone that participated, and we got these really inexpensively. I think they were what, $3 or $4 a water bottle, bought in bulk, but we were so fortunate enough to have the revenue from this grant, the extra funding to be able to have such great promotional material.
And just to echo the water bottle success, actually I think I was looking at it, about 20% of our visitors came because they Googled Each Aggie Matters water bottle. So